Today we talk about developmental dysplasia of hip.
Developmental dysplasia of hip, DDH, formerly known as congenital dysplasia of hip, denotes a wide spectrum of pathological conditions ranging from subtle acetabular dysplasia to irreducible hip dislocation with proximal femoral displacement. Developmental dysplasia of the hip, DDH, is a complex condition where the ball and socket joint of the hip does not form properly. Understanding the pathophysiology involves looking at how the structural components of the hip fail to align during development.
The pathophysiology can be broken down into several key structural issues. 1. Acetabular dysplasia. The socket, acetabulum, is too shallow or sloping rather than cup-shaped. Because the socket is shallow, the femoral head cannot seat deeply within it, making it unstable. 2. Subluxation. The femoral head is partially displaced from the socket but still maintains some contact. 3. Dislocation. The femoral head is completely out of the acetabulum. Let's discuss physical examination.
A positive Ortolani sign. If the hip was dislocated, the upward pressure and outward movement will cause the femoral head to slip back over the posterior rim of the acetabulum and into the socket. This produces a distinct, palpable clunk that the examiner can feel.
A positive Barlow sign. If the hip is unstable, this downward and inward pressure will cause the femoral head to slip right out of the back of the acetabulum, the hip socket. The examiner will feel a palpable clunk as the joint dislocates. A Pavlik harness is a dynamic splint specifically designed to treat developmental dysplasia of the hip, DDH, in infants, typically under 6 months of age. Unlike a rigid cast, the Pavlik harness is made of soft straps. Its goal is not to forcefully lock the hip in place, but rather to gently position the baby's legs in a way that naturally encourages the hip joint to stabilize and grow correctly. Thanks for watching.